So if you have a healthcare system that doesn't know what wholeness is, that's not addressing it, then de facto that healthcare system is looking at the person as incomplete and they're understanding the person as incomplete. So any diagnosis or treatment that is going to come from that healthcare system is going to be incomplete.
Hey there, you're listening to Delve, a podcast by McGill University where we want to change how you think about management. My name's Eric DeCare, and I'm Delve's managing editor. So the voice that you just heard is Dr. Anoop Kumar, an emergency physician and an alumnus of McGill's International Management Health Leadership Program. And in that clip, he's highlighting a significant blind spot in healthcare. He's pointing out how physicians often neglect to see patients as whole, emotionally complex people, and leave them feeling uncared for as a result, even if they received the treatment that they needed. So in a way, this is about bedside manners, but it's also about so much more than that. Dr. Kumar wants us to see the whole patient, and through that wholeness, we can not only help them feel cared for, but we can also dramatically improve their health. So in this conversation, he sits down with our editor-in-chief, Professor Saku Mantere, and they talk about what it means to see the whole patient, why it's so rare in healthcare, and why we should reorient our healthcare services towards wholeness. So if you like this kind of content, don't forget to subscribe in your podcast player. We put out conversations just like this one every 2 weeks. And with that, here's Dr. Anoop Kumar and Professor Saku Mantere on wholeness in healthcare. So let's delve into it.
All right, everybody. I'm talking to my old buddy Anoop Kumar, and Anoop and I actually met in IMHL when we were working on his final paper or his thesis. And Anoop has had a very, very long history of thinking deeply about both health and care. He's an experienced meditator and sort of builds his own practice also on philosophical positions that we'll explore a little bit. But Anoop, I'd like to start by talking about healthcare, and I have a sense that there are systems of healthcare which don't really care and which also are not that focused on health. So there's this pathology that has seeped into many organizations that purport to provide healthcare that actually aren't providing either. So how would you view this?
From what I remember from IMHL, actually, I believe the first module, day one, was what is health? I don't know if it's still that way, but that's the question I think we're exploring now, and a very pertinent question. It's not something that was asked in medical school. It's not something that the healthcare system really asks, at least here in the United States. So I think that is a key question about what is health. To me, health is wholeness, even etymologically, right? Health, heal, whole. And so we have this profound question before us, which is, what does it mean to be whole? I mean, every time we use the word healthcare, and that word is popular, healthcare systems, so many companies now have the word health after them, like this health, that health. Every time we say that, we're saying wholeness. And what does it mean? What does it mean to be a whole human being? What are even the aspects of the whole human being? What is the anatomy of a whole human being? I think it's a profound question. I don't know that we're going to answer that now, but I want to put that in front of us.
Yeah.
I think it's a huge looming question that exists every time we talk about healthcare, even in the most conventional settings.
Okay, so that's a great basis. So wholeness, I think one way to approach that would be to say that if you're not whole, then you're incomplete in some way. So that you're missing something missing, something that you're trying to complete.
Right. So if you have a healthcare system that doesn't know what wholeness is, that's not addressing it, then de facto that healthcare system is looking at the person as incomplete, and they're understanding the person as incomplete. So any diagnosis or treatment that is going to come from that healthcare system is going to be incomplete. Now, I would say to some extent, people would say that's okay. They would say, well, that's why we have other systems in society, right? You have friends, you have spiritual groups, you have your club, whatever it is. maybe to address other aspects of us? I mean, these are open questions, but I think it's really important to know that when we go to a healthcare system because something is bothering us, because we have a dis-ease of some kind, it is not necessary that the worldview of that healthcare system can address what we are coming with, because it does not understand wholeness. It may not understand wholeness.
So you work as an ER physician. That's a part of the repertoire of activities. How would you link that experience to your understanding of health as wholeness?
So in medical school, we talk about it in terms of rapport. We say, the patient-doctor relationship, building rapport with your patient, that relationship. And I actually think that is, of course, how we address it. That's how all human beings address it. Like, we build a relationship with each other and we see each other, right? What does it mean to say, I see you? It implies that I see enough of you, hopefully, or sufficiently enough, or maybe not the entire wholeness, but a good amount of that. That's what we mean, this rapport, this relationship. But what happens in healthcare is that the education we have defines a human being as a bunch of parts, right? That's what we call anatomy. I have my anatomy textbook back there from medical school.
Okay.
We say that, okay, I can know Saku well enough if I put together a bunch of protons, neutrons, and electrons. I have Saku. That's the philosophy of allopathic medicine, at least. And the rest we have to make up with rapport. We don't know what it is. We can't really talk about it in detail, but that's all rapport. So anatomy plus rapport equals the whole human being in healthcare. And I think that creates problems, because what we tend to believe is that rapport is kind of soft, and the anatomy and stuff, that's the hard stuff. That's the real stuff. That's the measurable stuff. And so in practical sense, in the ER or in medicine today, we see a lot of physicians that are having difficulties because of this education of seeing people as machines and seeing ourselves as machines based on the philosophy we have, while the other stuff is considered soft.
Let's talk about care then. So, then it's funny. I think most of us, when we've had a bad experience, with a healthcare organization, we can sort of feel what it feels like to not be cared. That we, at the ER, I would imagine that you see a lot of people who are vulnerable. At least sort of the few visits that I've had to take to the ER, accompanying somebody or even as a client, sort of, that's a very vulnerable position to be in. Sort of, you fall down on your bike and it's just the middle of the night and sort of you're bleeding and you don't know if your arm is broken, and then you're sitting there and then sort of nurses are sort of chatting amongst themselves and sort of you're waiting for hours, and this kind of experience of really sort of not being cared for. And then there's the opposite, that sort of that you meet somebody and then you feel like, okay, so that now I feel care. So how do you approach that?
To me, care is attending to healing. Usually when we talk about care, it's the delivery of services, right? So it's the delivery of the treatment. It's where the patient, how you take the patient to where they're going, things like that. But what is all that really? It's actually attention to the healing process. And if we are already fundamentally whole, which I believe we are, then healing is a matter of realizing our wholeness. It's not making somebody whole. It's seeing them as whole and helping them realize their wholeness. Now, part of that might be antibiotics. Part of that might be literally surgery to take two parts and make them whole again. Part of that, but a big part of that, I think, is being with them, the presence, and seeing them as whole. And when we see somebody as whole, they see us as whole. We realize our wholeness more and more. So I think some of the particularities of care that we talk about in healthcare systems are actually special kinds of attention to healing.
So I'm almost sure you've taken the IM metal yourself, and you can predict a certain type of reaction or question that will almost immediately arise in most groups, which would be to say that this is all fine and well. However, the organization that I'm in is suffering from this kind of a resource shortage, and sort of, it's all fine and well for you to talk about all these ideals, but the reality that we're facing is frugal, and sort of, we can't help everybody, or we have to turn people away, or sort of we have to to prioritize and blah blah blah. And so how do you square that into the equation, so to speak?
I think the anger comes from not having a place to express these things that are possible within us. I think every human being innately, like I said, is whole. And I'm not saying anything profound or new. Everything I'm saying has been said for thousands of years. And I believe all of us know this to some extent. But on the outside, we all ask this question, okay, but what do we do about that? And to me, the answer is simple. For example, we're doing it now. We talk about it. And then we practice that a little bit. I see myself as whole. I see yourself as whole. I see my patient as whole to the best I can. I mean, I'm up and down like everybody else, right? But I can tell you that when I see my patients, when I speak to them and when I say, hey, you can actually do this on your own, whether it's something about nutrition or movement or connection or rest. Hey, you can do this and that can actually help you with this. You actually have capacity changes. There's nothing that lights them up more than that. When I'm recognizing somebody's capacity, I'm recognizing their power. I'm seeing them as more whole. It's a very simple, practical thing you can do, right? And there's a wrong way to do it by like, well, you should do this and you should do that. That's not going to help, right? But if I say, hey, this is also is an option. It's not just taking pills. It's not just the needle. It's not just the surgery. This is also possible. And there are people who have done this. There's nothing that lights them more over a couple decades of my work. So I think those very practical things are useful. And when we start doing that, things change and there are more opportunities that come up. And there are entire systems that have changed. Like Mayo Clinic has changed so many of their practices, or the Cleveland Clinic, because we know some of these things. People are studying wellness. All of this stuff is happening. It's in the early stages, but it's possible and it's happening.
What kind of change do you envision in the systems of healthcare that we have now? So what would be the most pressing changes that you would like to see?
The biggest thing by far is I believe every healthcare professional, especially physicians, but really every healthcare professional has a responsibility to talk about the capacity each person has to heal. That is not being talked about. And the excuse we give is that we don't have the science, which is not true. The science is there if we care to look at it and if we care to talk about it. But there are people who can people have reversed diseases. People have gotten off of medications. People have gotten better, sometimes by not doing what the doctor said. It doesn't mean it's unscientific because there's science to that end as well. And of course, it's important to look very carefully. I'm not saying I just worked 3 shifts in the ED, so I know all the conversations about evidence-based medicine, all that. Yet we know that there are incentives in healthcare that keep people patients. That's how the healthcare system also stays profitable. Right? It doesn't mean we do bad things only. We do a lot of good things. And we do things that are not incentivized for healing. And I believe
you overthrow capitalism. That's the only thing that we have to do to change the system. Is that what you're saying?
No, capitalism is neither here nor there. What I said is we have a responsibility to talk about the fact that people have the capacity to heal. That has nothing to do with capitalism. I brought that in because that's where they always go in that direction, and the science and the evidence is there. People can heal, and we have a responsibility to talk about that. The medical system we have will always be needed to some extent, but the question is how much does it need to be the way it is today, and how much can we actually help people heal and become independent?
What kind of a change do you see in the skill set of medical practitioners? So what kind of learning do you prescribe for practitioners if you were to take this idea of I hear you talk a lot about the capacity of the client to reach towards wholeness, that there's this kind of potential for wholeness, potential for healing, talking to clients about what they can do so that that there's a ugly word empowerment that I don't really like, but sort of, it sounds something like that. So it seems that there's something that you can reach another person in a particular way that they feel that, okay, I can take charge of my health. I can eat better. I can exercise. I can sort of, have, manage my anxiety, whatever it is that contemporary people need to do. But what kind of a skill set is that for a practitioner?
Yeah. Well, what I'm suggesting is that the part that's considered the rapport or seeing the person whole, or that might be considered soft, actually is a rigorous part also. That's what I'm trying to say. And so I'm not talking about just seeing the patient that way. The only way I can see you that way is if I'm that way. I see you in a sense only to the extent I see myself. If I'm wearing pink tinted sunglasses, you look pink, but it's not because you're pink. It's because I'm pink.
Yeah.
And so in the same way, if I'm telling a person that they can heal, to some extent, I have to experience that myself. I think, just as you said, empowerment is an ugly word. I think, lifestyle and prevention are ugly words because they've become so bland that they're almost meaningless. And everybody agrees with it. Yeah, lifestyle is important. Prevention is important. Wellness is another one. Wellness is important. But they've become almost meaningless because they don't have the edges and the definition to really mean something more. But what I'm saying is factors like nutrition, movement, connection, and rest, which are the ones that I talk about, that we, going back to your original question about what is it that the practitioner can do, the professional can do, we have to start practicing this, right? You wouldn't expect a scientist to put out scientific reports if they're not honing the practice of science. We cannot expect health practitioners, doctors, nurses to render care, attention to healing, if we are not attending to healing ourselves.
Yeah, it's funny because now I'm reminded of another final thesis that I supervised in the IMHL, Marty Coyle, who's also been teaching at the program, who looked at second victim syndrome of practitioners, that sort of moral injury, that when the system is mistreating the practitioner or the client, that they're unable to provide the care that they feel that the client would need, then they're also wounded by that. And I remember Marty, when we talked about, he once said that sort of the next thing that anybody tells me to do yoga, I'm gonna just sort of blow up that this type. And I guess that's a really interesting and important further layer of what you're saying, is that sort of, if we do become cynical of how we are treated, and sort of if these things are kind of treated as you said, that wellness can be a very, very ugly word as well. If it's meant that sort of wellness is you're responsible of making sure that you can take the abuse that you have to take at work, which is, I think that isn't that a part of the the time-honored tradition of the medical profession, that sort of you sort of bully and humiliate the young ones until they're sort of ready to do that to others, in a sense.
It's changing a lot in the last 10 years, so it's changed a lot. But yes, I think I trained when that was starting to change. Yeah. Yeah. And what you're talking about in terms of earlier, when people said, they might feel angry at hearing some of this, or the person who says, if somebody tells me to yoga, I'm going to blow up. Let's be clear. This has nothing to do with healthcare. This is a human issue that's timeless. And this is a person who hasn't been heard, who doesn't feel understood, and dare I say, who doesn't feel love within themselves in that moment. I'm not saying anything else, but in that moment, they're not feeling seen or accepted. So it's not, if I go and say, hey, do wellness, hey, do yoga, that's on me. That's my ignorance, right? I need to be able to meet a person where they are. There's nothing complex happening here, in my view.
Yeah, I guess, the one implication that I draw from this is that the way that the system treats its practitioners as well, so the organizations, how you are governed, the experience of being able to help others is also important. That sort of, there's no separate register of a wellness practice that allows you to then tolerate a dysfunctional system, but sort of, it is a part of the well-being of everybody. It's also work towards the functionality of that system, in a way. That's sort of...
There's a big conversation happening today around resilience, right? And resilience is another one of those wellness type words where, of course, resilience is good, but do you want to teach resilience to an oppressive system? No. And I'm not saying a system, I'm not talking about any particular system, but there's always that balance where the turtle has its shell, but you don't want to teach it to retreat into the shell and just rely on the shell, right? It's got to live in the world. And part of it is creating that world and contributing to that world creatively so that maybe we don't have to be as resilient. We can be even more creative.
How would you advise, somebody, junior member of your profession or sort of, a following cohort after you, that if they want to, induce changes for the better in the healthcare system around them, what have been some of the experiences that you've felt able to do that?
Yeah, I'm going to respond with something so simple and obvious that you probably would have heard before. Well, first I would say, let people speak. People have so much to say, so much to unload. The most meaningful patient experiences I have are the ones where I just stay quiet and I let them unload. We don't have time. I could tell you all kinds of cool stories about that. But not just patients, your colleagues. Colleagues are stressed out. The executives are stressed out because they have to always smile and pretend like things are going and be the leaders and leadership. And while there's a mess going on around them, right? People need to let go. And I think if a person wants to be some kind of a change agent or is a change agent, you have to have the capacity to let people speak. Whether you agree or disagree, that's number one. For that to happen, for you to be able to hear emotional perspectives with lots of story and history behind it, with lots of clarity or confusion behind it, with perspectives that may strongly agree or disagree with you, you have to do the work yourself. There's no other way. I cannot be there for someone if I'm already full and I'm just waiting to pop off. So whatever that is to you, lifestyle, prevention, whatever, being yourself, getting outside, some of the things that we consider soft are literally the most important things, because that's what gives us the resource to be with others and ultimately change the hard things.
That's a beautiful conclusion. So thank you so much, Anoop.
Thanks, Saku.
All right, and that is today's episode. Thank you so much for listening. And thank you to Dr. Kumar for joining us and sharing his thoughts with us today. So if you like what you heard, don't forget to subscribe in your podcast player right now. We put out episodes just like this one every 2 weeks. And why not send us an email with what you think about today's episode? We'd love to hear from you. You can reach us at delve@mcgill.ca. So Delve is the official thought leadership platform of the Desautels Faculty of Management at McGill University. My name is Eric DeCare. I am Delve's managing editor. Professor Saku Mantere is our editor-in-chief, and he was your host today, and he produced all of the original music. So with that, thank you so much for listening, and we will catch you next time.